So today we will be doing breast reduction for this patient. She is a 32-year female patient having a child, and we can definitely see her breasts are quite big, and it is pendulous, it has sagged also. So let us go for the marking. So to start with the marking, this is the suprasternal notch, this is the first marking, and then we will draw the midline. So this is the midline. So this is the midline. Then we will have some measurements. The measurements are, we can see that her suprasternal notch to nipple distance in right side is 34 centimeter. So it is 34 centimeter in right side, and also in left side it is 34 centimeter. So almost same. This is also 34. The next important marking is superior breast border. So making the superior breast border is very important, because all the markings will be based on the superior breast border. So there are few salient points to see the superior breast border. First is this pre-axillary fullness. Superior breast border shouldn't cross this pre-axillary fullness. So this is the pre-axillary fullness in right side, in left side. গায়ে কাপড় দাও, কিছু বলছেন ওরা, জিজ্ঞেস করো। ওয়াশরুমে যাচ্ছে বাচ্চা? So we have marked this superior breast, this is the pre-axillary fullness. Then the second point to mark the superior breast border, because like the inferior breast border which is quite prominent, superior breast border is not prominent. So we have to take certain salient points to demarcate where is the superior breast border. So first point is the pre-axillary fullness. Breast starts below this pre-axillary fullness. This is one. Second one is that because of the rapid expansion of the tissue, there is stria marks. So where this stria marks ends, I can see the stria marks. So the stria marks denotes that this is one on stria marks. So these are the somewhat these stria marks. So the stria marks where it begins, that is the another point of demarcation. Another thing is that we can just elevate the breast. We can just কাছে নিয়ে এসো, একটু উঁচু করো, ঠিক আছে, একটু নিচে এভাবে করে দাও। So these are the stria marks. So more or less here will be the superior breast border. Another thing is that if you elevate the breast, so you can find a ill-defined line here. So this is the chest one. So more or less this is the superior breast border. Okay, it is always better to have a superior breast border. You mark little bit of lower, because this tissue is pulling the skin, so superior breast border descends. So this is our superior breast border in the right side. Then using the same principle we will do marking for the left side. So we can see the superior breast border in right side is almost 13 centimeter. In this axis, this nipple to suprasternal axis, it is around yes, it is around 13 centimeter. So this 13 centimeter is here, 13. Also in this same axis, if we mark, this is also 13 centimeter, 13. So this is 34 and this is 13. Then the next marking will be the breast meridian. This is very important to mark the breast meridian, and the concept of breast meridian is very much volatile or very much ill defined. So breast meridian is the line through which the nipple descends. So breast meridian is the line through which the nipple should descend or should ascend. That is the breast meridian. Sometimes we go through this nipple, but you can see in some few patients the nipple may be very medially located, the nipple may be laterally located, this breast may be asymmetrical, and also in two side their breast meridian may be indifferent if you go through the nipple, but actually the breast meridian should be a line through which the breast should descend or ascend aesthetically. So that should be the breast meridian. So now we will go for the breast meridian. And another thing is that the breast meridian can be measured through a arbitrary line that is passing in this superior breast border almost at 8 centimeter of distance. So, if we make 8 centimeter distance and then we make a line, that is also correspond to a breast meridian. So, we are taking 8 centimeter. So, this is 8 centimeter almost here, and from this side also we will go for 8 centimeter, little bit here. So, through this line we will be drawing the breast meridian. Another, then what we will do, this is a very easy thing, you just have this step, you go through this breast meridian, and in breast reduction what the tissue is remaining, that is very important, because excess tissue we are going to excise. So, we have to make these two pillars, especially the medial two pillars, very symmetrical. So, now I will be going in the midline. So, I will be standing in the middle and I will be seeing the symmetry of the breast meridian, because all the markings are aimed to make a symmetrical breast. Okay. So, you have to sit in front of the patient and your eyes should be in the level of the superior breast border. Then you just see that if you are placing these tapes in symmetry or not. You just see the symmetry at the clavicle level, you see the level at clavicle, clavicle it is around 5 centimeter, yes, it is 6 centimeter at clavicle, 6 centimeter at clavicle, and 8 centimeter at the superior breast border, 8 centimeter at the superior breast border, 8. So, step by step our marking is becoming complicated to understand. So, at the superior level it is 6 centimeter and at the superior border it is 8 centimeter, so 6 to 8. So, this is the square thing up. We will go through the lines. So, we can see we are far away from the nipple. Then we just drop it over the abdomen. So, we just drop it over the abdomen. Then I have to change. Then I will be lifting the breast. Breast, and I am using these paintings. Okay, I just extend these lines to above, going towards the inferior breast border, and then I just release the breast over here, and I can get a good impression just back of the breast. Okay, so this is the breast meridian. So, then again the same thing, I am just following this line, in reverse. Okay, so I am just following this line in reverse, going just below the inferior breast border, and then I am releasing this breast. So, this makes an impression on the breast. Okay, then I mark the inferior breast crease. This is the inferior breast crease, there is nothing speciality to mark here. So, inferior breast crease, madam, inferior breast crease. This heavy breast drags tissue from the lateral side, so there will be some lateral fullness. Okay. Now, I will be marking the excision. Pen দিয়ে করব, এই কাছে মাঝখানে চলে আসো। ঠিক আছে। So, this is the breast meridian, And now from the superior breast border I will take another 8 centimeter. So this is very important. Where should be the new nipple position? There are a lot of techniques to mark this new nipple position. Most commonly persons use this inferior breast border and they replicate over the superior surface. But sometimes if you just move your finger more vertically, then it's come over the breast border, superior breast border, or if you go more tangentially, it may becomes anywhere over the chest. So it is very difficult how you are pointing this finger, that depicts, because slight move in the finger, the nipple complex, the nipple areola position get changed. So the scientific way or the Hall-Finlay way is to mark from the superior breast border. So from the superior breast border superior breast border also we will go for 8 okay. From the superior breast border we also go up to 8 centimeter. Okay. So this is the nipple position. So this is the nipple position, we can go up to 9 centimeter. Okay. So this is the new nipple position in right side also, in left side also. So we are going here for 9 centimeter. So this is 9, this is 9, and this is the nipple position. This is the nipple position. Now from the nipple we will do the pillars. So what we have to do, we have to hold the breast like this, and you have to move the breast laterally and upwards, not just laterally, laterally and upwards, laterally and upwards. So I am moving it laterally and upwards, this may be, and then I am following the breast meridian, then I am following the breast meridian. This is how I mark the excision, lateral excision. So this was the lateral one. Similarly for the right side also, for the left side also I go like this, and then you just assess these two masses, if these two masses are symmetrical or not. Again I have to sit middle, again I have to sit in middle, and then I see the symmetry of my lateral margins of my medial pillars, sorry, of the medial pillars. These are the medial pillars. Okay, these are the medial pillars going to the breast meridian, going up to the breast meridian. Okay, so this is the medial pillar and this is the medial mass. Then similarly the lateral one, again for the lateral you have to hold the breast, move medially and upwards, move medially and upwards like this, and this is how you mark the lateral excision. Depending how much small she wants, we have to draw. Okay. ঠিক আছে, ফ্যানটা নিয়ে এসো। So from the nipple position, we will go 2 centimeter above. This will be the upper border of the areola. This is 2 centimeter, and on the both side we will take around 3 centimeter for the areolar opening. This is 3 centimeter, here also, here also. So this is 3, this is 3. Sorry, this is 2 centimeter, this is 2 centimeter, and this is 3 centimeter. 3, also here is 3. Now I will be making the areolar opening. So now I join this 2 and 3 centimeter opening. This coincides the areola, and this areola will be closed like this. So it will become a perfect round. কাছে চলে এসো। So So in breast meridian it is 2 centimeter. Notice na, so in breast meridian it is 2 centimeter, and also in lateral and medial pillar, it is 3 centimeter. And when we go, we close these 2 points, you see it's become a perfect round. Okay. Yes. Now how much we will do the pillar length? It is also 8 centimeter, because we know from the nipple areola complex to the inferior breast margin it is around 5 to 8 centimeter. We will take longer one, so the 8 centimeter. We will take 8 centimeter because the skin is stressed. When the stressing is gone, then we can see the skin shrinkage. Okay, so now we take another 8 centimeter. Now we go for another 8 centimeter from here. So this is 8 centimeter. What's marking? So this is 8 centimeter. 8 centimeter. Also from this areolar opening to 8 centimeter. So this is 8 centimeter. Yes. Yes, this is 8 centimeter. So this is 8 centimeter, and we will continue this border up to the midline. So this will be our inferior excision line. So this is the medial. This line will coincide with the neo. This line will go and sit over the inferior breast margin. So this is 8 centimeter. This one is 8 centimeter. Also this side is also. This is 8 centimeter. This 3 to 8. So total length is 8 plus 3, 11. Also in the lateral side we also go for 8 centimeter. So here this is also 8 centimeter, and here also 8 centimeter. Now we connect this 8 centimeter to the lateral anterior axillary line. So this is we connect. This is we connect with the anterior axillary line, parallel to the anterior axillary line. Okay, and we connect this 8 centimeter point to the inferior breast crease, which is going towards the axilla. So this will be the excision line. Also we make the round here, 3 centimeter, 2 centimeter above and 3 centimeter in the laterally. This will be roundish. Okay. Yes. Now we will be marking the breast pedicle. So this is a very important point to mark the breast pedicle. What we will do, we will take a 8 centimeter width. 8 centimeter width gives a good vascular control. So starting from the top, starting from this top of the on the areola and also in the breast meridian, we will draw a line. And will encircle the areola, and at this point we take another 8 centimeter measurement from this border, from the lateral pillar to medial pillar, taking 8 centimeter. Okay, from lateral pillar to 8 centimeter, taking little, we are connecting the straight line with this one. So this will be our pedicle containing the nipple areolar complex. This pedicle will rotate and go here. So this is also 8 centimeter. 8, and we can see the pedicle length will be around 11 centimeter. The pedicle length is around 11 centimeter. So it is 11. Again we will be connecting this line from the top or the apex, going encircling the nipple areola complex, and then why it is coinciding, we will go for the 8 centimeter from the medial to lateral, and then here. So this is our pedicle. Okay, this is our pedicle. So this is 8 centimeter. Okay, and also is this side also we can find our pedicle length is 11 centimeter. This is also 11 centimeter long pedicle. Okay. So to summarize, this is the suprasternal notch, this is the breast meridian, then we see the suprasternal notch to nipple is 34 centimeter, here also 34 centimeter, and the breast meridian in the same line is 13 centimeter. We draw the breast meridian from midline to the superior breast border 8 centimeter, at the clavicle it is 6 centimeter. We draw the breast meridian and we reverse the breast meridian on the undersurface of the breast. Then we mark the new nipple position 8 centimeter from the superior breast border, 8 centimeter from the superior breast border. Then from the superior breast border we mark the medial and lateral excision or the pillars. So superiorly and laterally, then you draw the medial border, and then also superiorly and medially, then we draw the lateral border. So on the lateral border we take 3 centimeter, and the breast meridian we take 2 centimeter first for the areola marking, and from this 3 centimeter to 8 centimeter, this is our pillar length. From this pillar length we go towards the midline. Again from this 3 centimeter we take another 8 centimeter, then we go to the axilla. This is our lateral pillar. So this lateral pillar and medial pillar will become the inferior breast. This lateral pillar and medial pillar will close and they will make the vertical line of the lollipop, and these two cut marks will become the new inferior breast line. And then we mark the breast, then we mark the pedicle. Pedicle is we coming from the apex or the superior breast border through the superior areolar opening, we make a line. Then from this cutting we make 8 centimeter pedicle length. This encircles the pedicle. Now we will do vascular Doppler to see whether this pedicle is containing any arterial supply or not. This will show how to do this color Doppler study. Doing the vascular marking to see if this pedicle 8 centimeter pedicle contains any perforators or not. So we will be just going through this line. So we travel from medial to lateral. Yes. So we can here almost near the breast meridian we can find a good perforator. This is the second intercostal perforators descending branch. ठीक है ये दा এটা লাল কালি है. So we mark it here. Then we will go further. Another perforator. Another perforator. So this is another perforator. So probably this one is the descending branch of the this is the So you can find the perforator. So probably this is the second branch, second intercostal perforator descending branch. Okay, and this one probably is the third one.